Are you or a loved one dealing with osteoporosis and considering Evenity? In this video, we'll explain how Evenity works, its approved uses for osteoporosis, and what to expect when it comes to Evenity side effects. Stay with us to learn if this powerful treatment is right for you. Evenity, Romosozumab, is a prescription medicine used for the treatment of osteoporosis in postmenopausal women who are at high risk of fracture. This includes women who have already sustained a fracture due to low bone density, those who cannot tolerate other osteoporosis treatments, or those for whom previous therapies have been ineffective. Evenity should only be prescribed and administered under the supervision of a specialist physician experienced in managing osteoporosis. It is available in a pre-filled syringe or pen, each containing 105 milligrams of Romosozumab. The standard dosage consists of 2 subcutaneous injections, administered at different body sites such as the abdomen, thigh, or upper arm, to deliver a total monthly dose of 210 milligrams. Treatment is typically given once a month for 12 months. What Evenity is used for? Evenity is used to treat osteoporosis in postmenopausal women who are at high risk for fractures, are unable to take other medications for osteoporosis, have not responded adequately to previous osteoporosis treatments. How Evenity works. Evenity contains Romosozumab, which belongs to a class of medications known as sclerostin inhibitors. Sclerostin is a naturally occurring protein in the body that limits bone formation and promotes bone resorption, breakdown. By inhibiting sclerostin, Romosozumab stimulates new bone formation and reduces bone loss simultaneously. This dual action helps to improve bone density and reduce the risk of fractures. Side effects of Evenity, Romosozumab. Like all medications, Evenity can cause side effects, although not everyone will experience them. Some side effects may improve over time as your body adjusts to the medication. However, you should inform your healthcare provider if any side effects persist or worsen. Common side effects. These side effects have been reported in clinical trials and occur in a noticeable percentage of patients. Joint pain, reported in approximately 8% to 13% of patients. Headache, reported in about 5% to 7%. Other possible side effects. These are less common but still recognized in some individuals. Swelling in the arms or legs. Neck pain, difficulty falling or staying asleep. Insomnia. Tingling or burning sensations, paresthesia, muscle spasms, general weakness or fatigue. Serious side effects. Seek immediate medical attention. Although rare, some side effects of Evenity are potentially serious and require prompt evaluation. Heart attack, myocardial infarction. Symptoms may include chest pain, shortness of breath, dizziness, or a feeling of pressure in the chest. Stroke. Symptoms may include sudden headache, changes in vision, loss of coordination or balance, difficulty speaking, or weakness/numbness on one side of the body. Allergic reactions. Signs include rash, hives, swelling of the face, lips, tongue, or throat, and difficulty breathing or swallowing. Unusual thigh bone fractures. Report any persistent, dull, or aching pain in the thigh, hip, or groin, as this could indicate a rare type of femoral fracture. What to do if you experience side effects. If you experience any new, unusual, or persistent symptoms while taking Evenity, contact your healthcare provider. In the case of serious symptoms, such as signs of a heart attack, stroke, or allergic reaction, seek emergency medical care immediately. Evenity should always be used under the supervision of a qualified healthcare provider, with careful assessment of your cardiovascular and fracture risk profile before and during treatment. Advantages of Evenity, Romosozumab. Dual mechanism of action. Evenity is unique in that it both promotes new bone formation and reduces bone resorption, breakdown, offering a comprehensive approach to treating osteoporosis. Monthly dosing. It is administered once a month, which may be more convenient compared to daily or weekly osteoporosis treatments. Limited duration of therapy. The full treatment course lasts only 12 months, providing a defined period of intensive bone-building therapy. Disadvantages of Evenity, Romosozumab. Injection-only formulation. Evenity is not available in tablet form and must be administered via subcutaneous injection. Requires medical supervision. Injections must be administered by a healthcare provider, typically requiring monthly clinic visits. Brand-only medication. Evenity is only available as a brand-name drug and may be more expensive or less accessible depending on insurance coverage. Pharmacist tips for using Evenity, Romosozumab. Injection details. Each monthly dose consists of 2 separate injections given consecutively in different sites, commonly the abdomen, thigh, or upper arm. These are administered under the skin, subcutaneously, by a healthcare provider. Missed dose. If a scheduled dose is missed, reschedule the appointment as soon as possible. The following dose should be given 1 month after the last administered injection, not based on the original schedule. Injection site reactions. It is normal to experience mild pain, redness, or swelling at the injection site. These usually resolve on their own, but persistent or worsening symptoms should be reported to your provider. Calcium and vitamin D supplementation. Patients are advised to take calcium and vitamin D while receiving Evenity. This helps reduce the risk of low calcium levels and supports bone building. These supplements are standard in osteoporosis care. Cardiovascular risk. Evenity has been associated with an increased risk of serious cardiovascular events, such as heart attack and stroke. Seek immediate medical attention for symptoms like chest pain, dizziness, shortness of breath, sudden headache, slurred speech, or weakness on one side of the body. Oral health precautions. Maintain good oral hygiene to reduce the risk of osteonecrosis of the jaw, a rare but serious side effect. Inform your provider before any dental surgery, and ensure your dentist knows you are receiving Evenity. Storage instructions. If you are handling Evenity at home, store it in the refrigerator. Once removed, it can be kept at room temperature for up to 30 days, but it must remain in its original packaging and protected from light. How effective is Evenity, Romosozumab? Clinical studies have demonstrated that Evenity is highly effective at reducing the risk of spinal fractures in postmenopausal women with osteoporosis. In a major clinical trial, Evenity reduced the risk of vertebral, spine, fractures by 73% after 12 months of treatment compared to placebo. The medication also increased bone mineral density, BMD, by approximately 13% in the spine, by about 5% in the hip and thigh bones. However, the medication has not been shown to significantly reduce the risk of non-spine, non-vertebral fractures in the same way. How long does it take for Evenity to work? Evenity begins to affect bone metabolism relatively quickly. Within 2 weeks of starting treatment, bone formation begins and bone resorption, breakdown slows. Full benefits are seen after 12 months, with measurable improvements in bone density and strength. Because osteoporosis often doesn't cause noticeable symptoms, you may not feel different while taking Evenity. However, staying consistent with monthly injections is critical to ensure the medication works as intended. Why is Evenity only used for 1 year? Evenity is designed as a 1-year treatment because its effect on stimulating new bone formation diminishes after 12 months. Prolonged use beyond 1 year does not provide additional bone-building benefit and may increase the risk of side effects. After completing a 12-month course of Evenity, it is standard practice to transition to a maintenance medication that helps preserve the new bone gained. These may include bisphosphonates, e.g., alendronate, Fosamax, ibandronate, Boniva, denosumab, Prolia. Your healthcare provider will help determine the most appropriate follow-up treatment based on your individual risk factors and response to Evenity. Evenity offers new hope for osteoporosis patients, but it's vital to understand both its benefits and potential risks. If you found this overview helpful, please like, subscribe, and share with others who want to learn more about Evenity uses for osteoporosis. And if you have questions about Evenity side effects or personal experiences to share, drop them in the comments below. We'd love to hear from you.